This is a patient with an APC3, so anterior posterior compression type 3, with complete instability of the pelvis. He has a pubic symphysis dislocation, a left ramus segmental fracture, a zone 3 sacral fracture that can be seen on the CT scan on the right here, and a dysmorphic upper sacral segment. So S1 is dysmorphic. So my plan of attack for this patient is to first fix the pubic symphysis, hold it in place, fix the ramus, which is segmentally fractured, which is what we would do initially in order to help to reduce the posterior elements. And then a compression transsacral screw followed by a CurvaFix implant that is placed through the S1 upper sacral segment. And what you see here essentially is initial on the bottom left wire and entry reamer, and then the ball tip steerable guide wire is placed through the S1 corridor, which, as you can see, is essentially curved in order to stay within the bone. Then reaming, followed by exchange tube, as you can see on the right. And then the CurvaFix implant is placed over the guide wire transsacrally in S1, which is dysmorphic. And this is pretty much impossible to do using a straight implant with a dysmorphism like this. Intra-op CT verification showed the sacral fracture to be anatomically reduced, and you can see the CurvaFix implant within the S1 corridor in the right location, both on the two upper images here. The bottom image is just to show the S2 corridor with a straight screw. That's what it looks like post-op. 3 months later, no change in movement of the fractures. They are essentially healed, and the CurvaFix implant is in good position and hasn't moved.